All right. So we talked about real like basic care. Let's get into dental emergencies. Can you tell me like what you see?
Definitely. We've gotten so many of those calls, especially now that it's getting nice out. We see trauma, especially in toddlers and sports age kids, shoot up. So, one thing I think is really important, especially for parents of young kids, is to have the name of a dentist saved in your phone because if you have one of these accidents, you don't want to be searching through Google. In this case, having an established dental home is really, really helpful in these situations. Number one rule of thumb is if a baby tooth comes out, you never want to put it back in because it could damage the adult tooth. And then with adult teeth, if your child's a little bit older, that's a true dental emergency. You want to go to the emergency room or a dentist ASAP because we could save the tooth lifelong and avoid a lot of costly emotional visits down the line. So you want to get that tooth in a cup of milk ASAP.
That's what I was gonna just ask you. All right, so I'm gonna break it down now. So we're gonna deal with just the baby teeth, and then we're gonna go to the adult teeth. So baby tooth, let's say completely falls out. Best management, I think you alluded to, is call your dentist. That is not going back in. You tell me.
Yes, exactly. Call your dentist. Keep the tooth in like a plastic baggie so your dentist can see and make sure that the whole tooth is out. Sometimes the root fractures and there's some stuff left behind. This is one of those visits where an x ray would likely be warranted because we want to make sure there's nothing left behind, depending on the age of your child and if they let us, those kinds of things.
Oh, see, no one would know that. That's such good advice. And what about if it's a portion of the tooth?
If it's a portion of the tooth, again, this is going to be age dependent, behavior dependent, and position dependent. So if it's a portion of the tooth and we're biting on that tooth, it's preventing us from eating, causing pain, discomfort. It's likely going to be recommended for an extraction. But there's so many other factors. You just want to make sure you see a dentist firsthand in person so they can evaluate and treat as needed.
So that's not necessarily an emergency though, correct me if I'm wrong, depending, like if it's just cracked apart, the bottom part fell off, it's not as if you're gonna replace it. So it's not like a time sensitive thing. Correct me if I'm wrong.
For if it a baby tooth, it's not gonna be a time-sensitive thing necessarily unless there's the nerve of the tooth, the pink part showing. If there's a pink part showing, you wanna see a dentist as well. They may try to save it, but again, if it's a baby tooth, it depends on the practitioner, the patient, a few other things.
Okay, so regardless, we're calling the dentist and
Yeah.
treating it within, we're gonna deal with the first few questions immediately. The other question I have for you, or really a statement, or you, again, correct me if I'm wrong, if the a portion of the tooth falls off and it's a young kid, the other part might be a an aspiration risk. And what that means is that the baby is at risk for inhaling it. So when do you see that and what do you do about that? Or like what kind of precautionary advice do you have around that?
If we're concerned about an aspiration risk or inhaling the tooth, the dentist will always wanna see it and make sure that it's not gonna be cause for concern down the line. If it were, they'd probably wanna extract the tooth. It depends again, but they always wanna see it
Okay.
if it is a risk.
Okay. And of course, these things don't happen 9 to 5 on a weekday. They happen in the middle of a holiday on a Sunday at night. So what is this something we go to the emergency room for?
So I think with adult teeth, always go to the emergency room. There are a lot of dental hotlines to call if you're concerned, and they'll be able to triage you, essentially to tell you whether or not to go to the emergency room. If you're ever concerned about head involvement, such as a concussion, vomiting, anything leaking from the nose, always go to the emergency room. The dental care will come after that. We just want to make sure there's no loss of consciousness and any issues with the brain. But in terms of dental, we also on our Firstgrin app have a free dental trauma guide, so it will help divert you whether or not it's a true emergency.
Oh, that's awesome. Tell me more about it.
So I know this doesn't exist for parents, so I created it based on guidelines. It has pictures based on baby or adult teeth if we have an accident, and it gives you a decision tree on what to do, how to do it, and when based on the trauma. So it makes it very easy for parents in a stressful situation because the last thing we want you to do is to be Googling what to do next. If it is time sensitive, we want you to make the right decision soon.
That's great. And so let's get back into the adult teeth. I want to reiterate again because everyone's, if it happens, it's a bit of a panic state.
Yes, yes.
What do you do with the tooth? I think that's what everyone on everyone's mind.
Definitely. So if the whole tooth comes out, even if a part of the tooth comes out, put it in a little baggie or a cup of milk. It's going to help hydrate the tooth and keep the cells around the tooth if it came out alive, for ideally long enough to be put back into the mouth and then for the next steps to be taken.
What does it mean for a tooth to be alive?
So that's a great question. There's a blood supply to the tooth, and we just want to make sure that isn't compromised because if the tooth doesn't get blood for a long enough period of time, it can die.
Okay. I honestly did not know the answer to that
That's a
question.
great question.
And then, okay, here's another one. What if you don't have milk available? What's the next best thing?
You could spit in a cup too, your own spit is very good. You could I mean, ideally not use regular water, you wanna do salt water. There's a material called Hank's Balanced Salt Solution that some first aid kids have, and some parents want to have on hand if they have dental trauma. That's, like, the ideal, it's just not very common.
Okay. I mean, yeah, I'm not like carrying
Yeah, exactly.
saltwater solution in case my tooth falls out, but maybe there's a pharmacy right there that
Yeah,
you could run
exactly.
to.